Click the Q&A icon in the webinar toolbar. You'll see 3 tabs: Open, Answered, and Dismiss.
Welcome both. Today we are going to be talking about where labor meets automation. And really the discussion is going to be focused on practical approaches to digital transformation, automation and AI, primarily as a means of filling the gaps left by the labor market's unprecedented disruptions to the labor market. We're obviously going to examine digital transformation journeys from a provider, Palomar Health, and roadblocks that they've had to overcome in all of that journey. And also going to be tapping into the knowledge of a solution provider who's also very much involved in this transformation and get their perspective. So I'm joined by 2 leaders and innovators who I will be bringing in their unique perspectives into this conversation. From health system from Palomar Health, I want to welcome Hugh King, the Chief Financial Officer of Palomar Health. And from D2 Solutions, I want to welcome the Chief Executive Officer, Dean Erhardt, who is really visionary in this space. So welcome both of you, and thank you for being with me today. I'd like to invite you both just to introduce yourselves and give some insight into sort of your roles and organizations, if you wouldn't mind. So Hugh, if I can ask you to go first.
So my name is Hugh King, as he said. I've been in the healthcare industry for a little over 50 years. As you can tell, I've got the gray hairs. Started out with Ernst & Young in their audit division, then moved into consulting, and then went into healthcare finance and hospital CFO roles. I've been at about 6 different multi-hospital systems from Florida to California and from Chicago to Texas. So I've seen a lot of interesting approaches to things. I think we're in one of the most interesting and dynamic periods of healthcare, especially with regard to our topic today, automation and artificial intelligence, and look forward to discussing it.
Absolutely, thank you. Dean.
Yeah, Dean Erhardt. I'm the president and CEO of D2 Solutions, and I've got about 35 years in the industry with a variety of Fortune 200 companies, let's call it, Express Scripts, Cardinal Health, and a company called US Healthcare that was eventually acquired by Aetna. Over the last 15 years, I've had the privilege of being able to really lead D2 from a consulting company into a technology and really digital transformation company. And we try to keep focused really on 3 simple things, right? How do we help organizations drive more revenue? How do we help them become more efficient, leveraging technology to be able to enhance their overall margins? And how do we take a look at enabling them to limit or be more restricted relative to their exposure to regulatory risk? So it's really those 3 items and listening to our clients in and around those activities that we're trying to solve for with hospitals, with pharmacies, with manufacturing, and a variety of constituents.
Fantastic, thank you. So I'm going to start off with Hugh. If you wouldn't mind, Hugh, just giving us a provider's perspective, can you sort of break down the digital transformation Palomar Health is undertaking and what that kind of means from a patient experience in particular?
Sure. So like all hospitals in today's environment, we're challenged both on the revenue side with growing our volumes and our services and decreasing amounts of payments for those services, or at least payments that are increasing, but not at the same rate as our salaries and equipment and supply costs is inflating. And then on the flip side, we've got the challenge of higher labor costs when we can get it, because part of our challenge is I think our hospital has about 340 to 350 open positions at any given time. So we have shortages across the board, not only in nursing, but in our technologists, in our back office functions, registration personnel, collections personnel, accounting personnel. So we're constantly looking at ways to replenish our staff and see automation and AI as a way to, 1, reduce our dependence on that staffing, and 2, reduce our costs, but also reduce our error rate and speed up our cash collections and cash inflows.
Absolutely. So yeah, there's a lot there. And I think interestingly, one of the things that I think when people think about this type of topic, that is displacing labor. But I think the reality is, and you touched on this just now, that it's actually about optimizing labor, particularly in a very tight, difficult labor market. Is that right?
Absolutely.
Yeah.
We see it as a way to fill gaps that we can't fill with people right now. I think it would be still a direction we would be going in, but to your point, in a different environment, we might be looking at reducing labor cost. In today's environment, we're just trying to get the work done with the staff we have available.
Yeah. How about from a patient experience perspective? Because obviously that's an important sort of element in all of this. And how does it work for them?
Sure. Well, so far it's been effective. We're still in the early stages of certain of our applications, but I'll tell you an interesting story. I got off the elevator in our administrative building, and we have administrative offices on the 3rd floor, which is the top floor of the building, and clinical services on the 1st and 2nd floor. I got off the elevator, had my required ID badge on, and a lady came up to me and introduced herself, and she said, "I just wanted to tell you something." And this was about a year ago. I've been using your facility for almost 7 years. But if you don't get some online tools that I can use, like I can use with, and I won't name the other hospitals that are our competitors, but Brand X and Brand Y, I'm going to switch. So I'm going to give you about 3 more months. But I thought that was a very interesting conversation. And this lady was probably in her late 50s, early 60s. So it wasn't like a Gen X person who was accosting us about our antiquated technology. It was a person in my age group, a boomer, who was ready for improved technology today and was disappointed that we didn't have some of those applications. So we really did take that to heart and are in the process of, we already have some of our tools, but rather than wait for what some people might call a big bang where we can do everything that we want to do, we've started with a more phased in approach. So we're providing more and more functionality to our registration and online applications. But one of the interesting things that's happened, we started with allowing patients to do their registration from home or in their car or in the lobby of our offices without actually coming into the offices. Kind of an offshoot of the COVID pandemic, where we had people that were coming in for testing, and we had set it up where they could register. And then we would call them into the office when they were ready for their testing. So they would literally sit in their cars in the parking lot. And that way we could minimize patient interaction and the risk of exposure. But now we can register them. We've noticed a significant drop in registration errors because the people that are doing the registration typically know more about their insurance programs, et cetera, than our registration clerks or personnel. And we've noticed a significant drop, I'd say about a 75% drop in our error rate. We've also been really impressed with the adoption rate of the technology. Our initial goal was hopefully that we would see somewhere between 40 and 45% of our patients doing online registration. And in fact, what we found is about 65 to 70% of them will attempt the online registration, with about 70 to 75% of those completing it. We have some people that get frustrated and drop out, or they get interrupted, maybe they lose connectivity, or their phone rings, whatever. But overall, our adoption rate has been a little over 50%, successful online registration, a little over 50%. And our current tracking shows that we're starting to trend up towards 60%. So we've automated a process. One of our real challenges in our physician offices is medical assistants. We're probably down to about 75% of our typical complement of medical assistants. So this has helped fill that gap significantly. And we've talked to a company, which we found really fascinating. They pointed out that in today's world, when you check into a hotel, one, you can register to your room, but nobody walks you up to your room. You're given a key and you're told where the room is, and you go and enter on your own. There's a medical group we've talked to in New York State, that actually has the patients, when they register, they're given a room number, and when they arrive, they're told what exam room to go to, so no one escorts them to the exam room. They walk in and there's a set of instructions for them, and the first person they see is the nurse that comes in to do their vitals. And we're even looking at automating vital signs, but that's probably a couple of years down the road for us. So I could talk about this ad infinitum, but I think I'll stop there.
There's lots of good stuff that you said there. I mean, I took from that, one of the things is, start somewhere, don't wait for the big bang. I think the fact that the patients really want this and adopt it much faster than you perhaps expected, and that's because patients want it and actually, I think, expect it in today's world. I'd love to bring Dean into this conversation. Dean, how did D2's offerings help provide and leverage digital transformation to address sort of our labor market's shortcomings?
Well, we've heard what Hugh's talking about from virtually everybody we work with, which is the biggest single challenge is we can't find enough people, right? In fact, if you extend that outside of the hospital to the pharmacies, which are a big segment of our audience as well, the National Community Pharmacists Association last August did a survey of 1,000 pharmacies, and the number one issue was their inability to get pharmacy techs. So this labor issue is affecting every issue around, being able to provide services in an appropriate way. We got engaged with a patient engagement platform a number of years ago because we were challenged by our clients who were struggling to be able to get a hold of patients, who were struggling to get patients enrolled in programs with why is this happening and why do we have this severe drop-off rate? So when we really took a look at that and evaluated it, it came down to, the very simple issue of they can't get a hold of patients. So this was really pre-COVID when, I'm calling patients, but because they don't recognize my phone number, they're not responding, they're not answering, and so I'm not able to get a hold of them. And by really tapping into a patient engagement platform with our model, which has what we call gaming technology, but really it's the flexibility of having branching logic that enables us to be able to customize the platform for whatever the use case happens to be. We're able to reach out to that patient. And we've got, kind of going back to Hugh's comment about the receptivity, we've got greater than an 86% response rate across all age cohorts. And it's because of the way we've really customized how we reach out and how we let that patient know that it's part of their healthcare, that this is part of their doctor or hospital system, whatever it might be applicable for that particular use case, and that there's very specific questions that need to be answered. And then we bring them into a HIPAA secure environment where they can feel comfortable that they're sharing information in a secure fashion. So being able to have those kind of parameters around that engagement, we see where patients are very comfortable engaging in, call it a healthcare discussion, digital.
Super interesting. So just sort of moving to the back end a little bit now, I understand, Hugh, that you're also modernizing the back end side of things. How is AI and automation helping streamline, optimize, and improve the integrity of key functions like revenue cycle, for example?
Well, I think the example that I gave in terms of, so one of the biggest challenges that we have in revenue cycle is either claims being rejected because the information gathered at registration was inaccurate, or because not rejected, but flat out denied because incorrect information was recorded at the point of registration. So increasing our accuracy in registration also speeds up our claims processing and payment, and also reduces the amount of time we have to spend dealing with denials. So that's been a significant impact on our front end revenues, our revenue cycle work, getting the front end information more accurate. So far that's been the single biggest item in the revenue cycle for us. Other areas that we're seeing improvements are things like back to customer service interaction. Patients, there's a law that went into effect in September of last year that's designed to keep hospitals, and it's actually called anti-blocking, but I don't think hospitals ever tried to block access to information. It's just you have a lot of disparate technologies providing information. So for example, if we have a separately licensed home health agency and a separately licensed physical therapy group, they may be on a different platform than we are. And if a patient wants to get their medical record, it's not like it's all captured in one fully electronic repository of information. So we've been using a technology that we're implementing and have started using a technology that allows the patient to come on to our website and say, I want to get medical record information. And it will ask them, can you give us a general idea about what you want to use this information for? Do you want to continue treatment? Are you involved in the legal action? Are you involved in, you need information for your insurance company? You're seeking care from a specialist. And we have algorithms. Actually, the vendor has algorithms that will say, when people select this purpose for obtaining their medical records, they generally want these 6 items from their medical record, rather than requesting, 30 or 40 or 100 different components of their medical record. It narrows it down. Are these the types of information you need to fulfill your goal? If they say yes, then we have bots that go out and grab that information from whatever system it resides in and transmit it to the patient. And by the way, this technology also gives us a way to validate that the patient is who they say they are, and they electronically sign a release saying, I'm who I'm supposed to be, here's my proof, and I'm electronically authorizing you to dispense this information. So, which we had to do manually before we got this technology. And then the time to pull the medical records has gone down dramatically. We're still not as far as we want to be. We think that over the next 2 to 3 years, we can completely do away with what the traditional medical records department was at our hospital. We'll still have to do some things like coding and specialized release of medical records for law firms, et cetera. But for the most part, we'll be able to eliminate most of the traditional medical records department.
Yeah, I think you're hitting a bunch of different things there, right? Regulatory compliance, you're delighting the patient, right? Because I'm sure they like to be able to get that information quickly and sort of, oh yeah, that's exactly what I'm looking for. And you're bringing efficiency and cost savings and labor savings to the hospital health system. So it's sort of the trifecta, so to speak. I'd love to bring Dean into this as well, because I know that's really kind of what you guys are focused on very much, and just how you sort of see this and how you yourselves actually help them in these different areas around prior authorization, patient engagement, pharmacy, etc.
Yeah, I think there's a variety of issues there. You mentioned that we're very close with a couple of organizations where we're working as well. Almost think about what you're describing as, a dashboard above the dashboard, where you're collating various different, as you put it, disparate locations and disparate information systems, pulling them into what we call one source of truth and being able to report that data in one environment. So, and then, if you take a look at the revenue cycle, one of the things that we've really focused on with a tool that we call UltraTouch Verify is automating the prior authorization pieces of being able to get patients on medication across both pharmacy and medical. And so what we've seen historically is that, prior authorization in many organizations can take as long as 6 to 10 days, because you're dealing with payers that, let's just say they're not aggressive in wanting to be the first one to approve payment. But more importantly, what we see is that the process, which is really a human element process, is largely challenged because we as humans just we're busy doing 400 things, to the point that you've made earlier, Hugh. We're very short staffed. And so we're submitting these prior authorizations, and many times they are incomplete. They have errors. I didn't check, male or female on the application. And so they get back from payers. So what we see is that in almost 90% of the cases, when a PA takes longer than what it should, or when it gets kicked back from a payer, it's not because the patient shouldn't be on the product. It's because there was an error in that submission up front. So what we've done is created an automation mechanism where we eliminate that error process. And by virtue of that, 96% of the submissions that are submitted using our technology tool are approved the first time through. And our average turnaround time on a PA is less than 22 hours right now, within a construct that we're in the industry, it's about 6 to 10 days on average. In addition, kind of going back to the whole patient engagement process, what we've seen historically is that there's a lot of what I call high volume, but low value activity that staff is forced to do by virtue of the fact that they need to schedule an appointment, and they need to capture an insurance card, that they need to make sure that somebody has, checked in to get their colonoscopy scheduled, whatever the case might be. And what we've done is really taking our patient engagement platform, which again, we acquired from a gaming environment, to be able to automate proactive patient outreach and really accelerate the capture of that information and boost the consumerism experience on behalf of that patients. Our response rate, again, is greater than 80% or 85% actually. And really what this does is enable organizations as a whole to have a tremendous amount of flexibility in how they communicate with patients, how they capture patient information, and again, leverage the fact that, and I think, Hugh, you made a great point. In some instances, 5 years ago, you might have taken a look at how do I have less personnel? Today, it's how do I do as much as I possibly can with the personnel I have, because I already have less personnel. So leveraging these technologies that can, in many cases, give the consumer, or the patient, I should say, very much of a consumer experience, really enables us to be able to get a lot more activity from that patient interaction than even in some cases you can do with humans. And I love what you said about, we're getting less registration errors. We're getting a drop in errors of various different kinds, and we're getting high throughput relative to that patient interaction. And it's because we all, whether you're 8 or 85 in today's world, know how to use technology. People live on their phone, and they really are more comfortable putting information in that environment. And to your point, they know more about what they need to put in than the staff does. Further, what we've really been helping a lot of hospitals with is taking a look at where they have other stuff where they need to collect and collate a large piece of data. So accreditation, as an example, is one piece where we're helping a lot of organizations, whether it be in their outpatient pharmacy situations with URAC and ACHC, or whether it's something like joint commissions, where you capture that data digitally, you put it into a digital environment, and now you can marry what you need to do as an institution with what you might be doing with your patients, i.e. patient outreach, consumer information that you're capturing and tying together for HEDIS reporting, as an example, where you have to track hundreds, if not thousands, of licenses across a facility, whether it be facility license, pharmacy license, physician license, tech license, licenses for your MRI machines. I mean, there's just a plethora of activities. And what we've done is we've collated that all into one environment where you can have, again, one source of truth where you're tracking that, where there can be an alert system, where you can flag what's coming up and what's coming due over the next week, month, 2 months, 3 months, so that you don't have somebody tracking it on a spreadsheet, which is what we've historically seen, which is Excel can be your friend and Excel can be your monster. But all of a sudden, when Jim Bob leaves the company because he got a better job, I've had somebody say I couldn't even open Jim Bob's computer, much less get to the spreadsheet of what he was tracking. So now we've got an environment where you can have things like accreditation requirements, license compliance, regulatory compliance, all in one tool. And that really takes a lot of labor intensive activity off of the staff. Plus it puts things into a reporting mechanism where even at the highest levels of the organization, you can see in near real time where you're compliant with activities and where you're at risk for activities.
That's interesting. I know it's early days, Hugh, for where you're at with this sort of journey that the Palomar has started, but and you shared with us a little bit already about some of the results, but you know, obviously that's the thing that people I'm sure are thinking is what have the results been so far? Can you just shed a little bit more light there as to what you've seen, what you're excited about, and what you actually expect to see maybe in the near future?
Sure. So we've seen, even though we've not seen the volume that we have had in previous years in the first half of this fiscal year, our collections are up over 4% compared to last year, which for us translates into about $14 million so far, which in this environment we need. We've seen our nursing costs go up dramatically because of use of traveling or agency nurses. So we're able to make up for some of those losses through improved collection techniques. So that's one thing. To the point of tracking licenses, it's not just the licenses for the machines, but as you said, the doctors, the nurses, the technologists, the pharmacists, all get licensed by state and in some cases federal agencies. So we need to make sure that we are keeping those licensing activities up to date. We also have some regulatory issues around things like HR training programs like sexual harassment, equal opportunity employer activities, which we've automated almost all of that. So very rarely do we attend classes anymore. We do it online. The machine checks whether we've, even to the point of whether we've had our annual physical and that's been reported or not. So we have a number of vaccinations and other things that we have to do. So we've automated almost all of that. So that, and not only do I know what I have to do, but I also know what every employee that works in my division has or has not done. So I probably get 2 or 3 emails a day about somebody's license is up for, like the director of HIM, their license was up for renewal. Had they gotten the renewed license? Who's had their annual physical? Who's taken their anti-sexual harassment training? Who's taken their equal opportunity training, et cetera. So that's almost fully automated in our shop right now, as well as much of the recruiting. People submit their resumes or applications and they flow through the system to the appropriate parties for review with minimal manual interaction. So there, I mean, it's really interesting to compare when I started in the industry, where in those days we had key punch cards, the key punch charges that got put into machines. And of course, now much of the whole process is automated. So it's a very different world. But we still are, compared to some of the other industries that are out there, we're still a few steps behind.
Yeah, but it's an exciting time, I think, and an important time for hospitals to be thinking about this and actually doing it practically now, which is so interesting that you are doing that and how Dean's helping folks. Similar to you, Dean, you know, what have you seen as the results for some of your clients? I know there's a well-known hospital, for instance, Children's Hospital, I believe, that you work with, that has some really interesting results. But just give us a sense of what actually tangibly has been seen and recorded.
Yeah, so that particular example, you know, they're using our automated prior auth tool, and when we started with them, they were, had a turnaround time of almost 10 days to get a prior auth approved. Our average turnaround time on the prior auth with that particular organization, we're talking about north of 5,000 PAs a month, is less than 22 hours, and that's across both the pharmacy side and the medical side. So clearly, a lot more efficient in terms of the timeline, but not only that, but a lot more efficient in terms of personnel, because they need a lot less people to be able to call payers and follow up with payers and do all of that payer activity because it's submitted, into a digital database, and the database does kind of all of the rest of the work for them. We're also working with a variety of organizations on, that whole patient engagement front. And where we're seeing that impact is both on the responsiveness of the patients, but we're also seeing where we had a manufacturer we were working with on a program where 20 to 50% of the patients on a particular drug were falling off before they even got the therapy. And so by working with the specialty pharmacies, a couple of which were then within hospital systems, we were actually able to identify why that fall off was happening, change the way they were interacting with the patient with digital questions and digital interaction, and increase the capture of those patients by greater than 10%. So basically, we were able to capture 10% more patients, which added revenue into that hospital and revenue, obviously, to the manufacturer as well, without having any more personnel associated with that program. So really being able to capture, some pretty interesting thing. And then we've got a couple other hospitals we're working with where, they're 340B facilities and where they're seeing a lot of leakage in the 340B arena for a variety of reasons. And that's another area where technology can really, really impact your revenue opportunity. Because if you're losing those scripts to other third parties for, any number of reasons, there are technology opportunities to be able to capture those and be able to guide your staff to ensure that those prescriptions are actually captured and referred to your 340B pharmacy versus being captured and referred out of your 340B environment. So a lot of technology solutions that can help to not only do activities, but also work within the construct of your personnel to support personnel to work in a way that's in the best interest of the organization.
Bottom line, that drives revenue growth, right, and patient compliance adherence. So, which is obviously,
like I said earlier, our model is very simple, right? How do we help people drive more revenue? How do we help them be more efficient about it to capture more margin? And how do we structure programs to eliminate or decrease their exposure to regulatory risk? It's simple, but like I tell people, it's simple. It doesn't mean it's easy.
That's the thing. That
Fair statement.
Absolutely. I think what would be interesting to hear from you, Dean, is on, obviously you're an innovator in this digital transformation space. Where do you feel enterprising executives should be turning their attention towards next? What's coming?
Well, I think simplistically, we're in an environment where there's clearly the labor shortage is the number one headache for everybody, right? So how can technology solve for the gap in your service model, solve potentially for the gap in your ability to staff? And while there clearly are some aspects where you need a clinical intervention, you need a person-to-person conversation, whether that be with a nurse or whomever, but you need some human interaction. What other level of information, whatever other level of data, what other patient surveys, HEDIS surveys, URAC surveys, et cetera, can be done via automation to augment that human interaction, that human component, where you can do 60, 70, 80% of that via digital information or digital activity versus human. We are in what I call the age of volatility, right? Where the change, be it in technology, in the economy, in another pandemic, or whatever the case might be, right now labor driven is happening really fast, and it's more impactful than any time and certainly in my working career. At this point, I think what's evident is that we're not going to go back to a pre-pandemic environment, and the labor shortages that we see in the market are not going to change tomorrow. So what we have to figure out, whether we like it or not, is not where we would like to do more with less, but because we have to do more with less, how do we take a look at technologies to be able to solve for some of these issues?
Yeah, well said. I'd love to sort of redirect that to Hugh as well, from Palomar's perspective. What are the next sort of opportunities that you see for you to take advantage of?
Well, as I said, we're in a progressive evolution. So one of the things that we're working on now is not only self-registration, but self-scheduling for many of our physicians, where the patient can come on and try to pick an appointment time and date that's convenient for them if there's slotting. Some interesting challenges there. We have about a 300 physician medical group with about 20 or 30 medical specialties. So it's not just finding them another family practitioner if their current physician is booked solid for the next 3 weeks, but it's finding one that's in a location that's convenient to them, and one that may have an orientation toward their particular disease etymology. So we're working on those factors. It's a little more complex than we thought it would be, but I guess that's always the case. I suspect Dean finds that on a regular basis. But one of the things that we found fascinating is we've started using bots for some of our processes, especially in revenue cycle, but also in medical records. And as our colleagues in other clinical areas and other non-clinical back office functions have seen what we're doing or heard about what we're doing, we now have a line of people in line to start getting bots for their particular activities. So our bot company is on a premium scheduled basis right now, which we think is fascinating, and a lot of different areas that are not, if you sit down and think about it, it makes sense. But on the surface, when we started down this road, we did not see some of these areas as being as proactive as they apparently want to be. And so I think that the door is pretty open to opportunity as we think of new ways we can use technology.
Yeah, no, it's definitely a journey, and I would imagine. I mean, this. I think Dean mentioned it, and pretty much everybody in business, and not just healthcare, but other types of businesses I speak to, talks about the speed of change and how today's world, for various different reasons we've touched upon, that velocity of change is faster than ever, and if anything, it's accelerating. And for organizations to prosper, you need to navigate that, and change is the new normal. If anything, I'd love to know from an operational perspective, Hugh, change management barriers to achieving the digital vision that you have, and what advice would you give to peers looking to go down a similar path?
Well, I guess the first one is the old adage, never let perfection get in the way of good. I think we've had a number of people who, as they looked at what we wanted to do, we have a project, much of the project I've discussed today, we call the front door project. It's, how do we get people in our front door in a more digital, user-friendly way? Well, as we went more down this road, we had a lot of people that thought, well, let's convert it into the patient experience project, because there's a lot of things we can do to improve patient experience. And then it became, well, patient and physician experience. And the project kept growing, but nobody was willing to move forward until we fully defined the whole project. And at a certain point, we had to say, in this case, I had to say, but okay, we need to stop adding to this program, go back to a phase 1, phase 2, phase 3 approach, because it'll be a year or 2 years before we do anything if we keep letting this project grow. And that's when we went back to the phased step-by-step approach. So that's one thing. As people find out what this technology can do, or what technology can do, more and more people want it, and they want it now, but not everybody can have everything right now. So you have to really prioritize and think about a step-by-step process. So I'd say that's the first thing. I'd say the other thing is just overcoming, and again, I suspect Dean sees this all the time, overcoming some historical concerns that people have. For example, the idea that a person can log on to our website and request patient information without ever interacting with a human being, that all of this validation and verification can be done electronically and safely was an area of concern to some of our staff. As we walked through it with them, they came to the realization that the level of accuracy would be the same, if not better, because the computer can't be conned by, well, I'm calling on behalf of my daughter and I don't have her information right now, but it's really critical that I get this data. And can't you help me out because I'm standing outside the emergency room right now, et cetera, et cetera, et cetera. And the computer is a little bit more rigid in complying with our protocols. But we did have that as an obstacle. Of course, we're in California, we have 2 labor unions, so there's always the issue of how jobs will be impacted by the implementation of some of this technology. I think those are the 3 biggest things for us. And again, my biggest problem is sort of, so to speak, speed to market, with people trying to add on to the projects rather than let's get this first thing done and then move on to the next thing.
Yeah, start small, start simple, and get movement and prioritize well. And then communicate, I think, is a big part of that with your people, is to listening to them and obviously
That's a good point too. Don't just roll out the technology with the expectation that people will automatically know what to do and how to use it. I'm reminded of people that might be listening that are flyers. If you've been to an airport that has the CLEAR program, theoretically, you can walk up to the machine, it will scan you and say you're okay to go through, but they have a staff of people there to help you get through the process until they get it to a point where they don't need manual intervention. We've had to have people, even though we have kiosks for registration in the physician's offices or in lobbies of the larger multi-specialty offices, we've still found that for a period of time, it's good to have a person on site that can say to people that walk in, where there might be people waiting to register, I can help you get registered online and show you how to do this so you never have to wait in line again. In fact, you can do this from your home or from your car in the parking lot in the future. So we walk them through the process. So that's usually about I'd say 1 month to 6 week project to get the adoption level that you want to get. So that was another challenge that we really didn't realize how important it was to do that, especially with some of the physicians that treat an older population that they're comfortable with the technology, but not necessarily that they may be Apple users or another technology, and they're used to doing things one way. But that's been one of the things we've learned.
Yeah. Let's bring you in, Dean, on this, because I'm sure you see all kinds of things. This is a problem.
I think there were some great comments there, not the least of which is, I think in some cases people are concerned that, I will never have a job here if I adopt technology. But going back to, kind of our earlier discussion, if you need a staff of 10 people to work in this department and you can only find 5, and you're lucky to keep 5, then technology can make up for the lack of the other 5 that you don't have. And that's really, marrying, what I like to say, marrying technology with people so that you can get the most out of those people by leveraging that technology. The other piece I do think that is interesting too, that I didn't hear Hugh mention specifically, but I'm sure he's felt the pain, is creating a process where it's relatively easy to have a new technology that is introduced without disrupting existing technology or legacy systems of which you're dependent on to run your business. So we've really focused on enabling activities kind of with a technology on top of the technology that's there, and then simplifying it by being able to connect in with those systems, be it an Epic, be it a Cerner, but being able to do a simple connectivity where you can push information back and forth, and you're not disrupting things, you're really enhancing the level of information that can be captured and reported against.
Yeah, I agree with Dean's comments. Most of our successes have come from systems that sit on top of the existing systems and make things happen. As you say, push information from one system to another and back. If we had to wait on some of our legacy vendors to be able to move forward, we would not have moved at all yet.
It's the 2+2 that I always hear about, Hugh. And it's going to be at least 2 years and $2 million. So you better figure out a different way.
Yeah, exactly.
Oh, well, look, thank you, both of you. This has been a fascinating discussion, and I really enjoyed it. We're going to open the discussion up now to questions from the audience and hand over to them. So thank you both, Hugh and Dean.
Okay, so I'm going to ask, let's see, promote panelist, and I'm going to ask Hugh and Dean to come on camera when they can for our live Q&A session. Hello.
Good afternoon. Good morning.
Good morning, good afternoon, wherever we are. Wonderful. So I'm just going to dive right into these questions. The first one is for you, Hugh. You said that you're impressed with the online registration uptake. Are your numbers so high just because patients are hungry for that kind of tool? Or do you think there's something about how you've designed or advertised it? Thank you.
Well, I think they are hungry for it. I'll share an anecdote from several months ago. I was in our administrative office building where we also have clinic facilities. And as I got off the elevator, I had my name badge on. And this woman who was probably close to my age stopped me and she said, "When are you guys going to get an online tool? I've been a patient at your hospital for 9 years and I'm fed up with waiting. If I don't get something in the next 3 months, I'm going to switch to a different healthcare system." I was shocked by that. So I think the market is hungry for this technology. I think a lot of places are ahead of us in the sense that, another anecdotal story, several months ago, I went for my annual physical and went to LabCorp to have blood drawn. And when I walked in, there was a kiosk. I put the appropriate information in. It said, put your insurance card in. It read both sides of my insurance card. Put your driver's license in. I did that. I didn't see another person until the phlebotomist came to get me to draw blood. And I thought, boy, this was really simple. So, and I liked it better than the process that we had at Palomar. I think patients are hungry for this technology. A large percentage of them are. And during the pandemic, I know there were some organizations that had registration on your phones. So you would get notified. In fact, we did this with several of our clinics in terms of our COVID testing that would notify you it's time to come in and get your test so that you weren't in an office with other people. That technology has evolved, and I think a lot of people just expect it now. And when you offer it to them, they're happy to accept it.
Oh, wow. That's amazing. That's really awesome. Dean, okay, he's just joining now. The next question is for him. So I'll give him a few seconds to pop on.
Hey, Shalem.
Hey,
Hi.
Dean, can you hear us?
Didn't want to play nice. Yes, I can hear you fine.
Not a problem. Well, Dean, the next question is for you. It is, can you tell us more about the branching logic that helps customize patient engagement? Is there AI behind that?
Yeah, effectively, yes. So if you think about gaming when you play games, right? I don't care if it's, a war game or if it's Madden football. You're going to throw a deep pass versus punt the ball versus run the ball into the line. There's a variety of different things that happen, and they happen instantaneously in real time as you're playing the game. Well, when we're looking at technology within the construct of healthcare and the delivery of healthcare, why don't we use the same technology that can effectively respond in real time to what patients respond to you with? So you're interacting with somebody, they're responding to a question or some other stimuli. Why can't we respond to them in real time and give them the ability to branch down multiple different branches depending on how that response looks? So effectively, it's the same concept as branching logic that's used in a gaming environment and gives you the flexibility of being able to interact with patients as if they were, oh yeah, consumers, which is really what they are. They're just consumers of healthcare.
Yeah, awesome. That makes total sense. So Hugh, this one's back to you. Are there some of the later phases going to be focused on the back end of revenue cycle? And if so, what kinds of technology or automations do you have your eye on?
Yes, there will be. For right now, we're more focused on things like, making sure the cash is properly applied, making sure that we've got denial appeals processes in place. By back end, I'm assuming you're talking about after the bill's out the door and more when the bill gets posted, when we get a payment. We do have a technology that is not a brand new technology, but we recently implemented a new vendor who we're very impressed with that has all of our contracts modeled. And so when we receive a payment, it lets us know whether or not that payment was the expected amount plus or minus a de minimis variation. And if not, sends it to a queue for somebody to get in touch with that vendor to follow up. That's improved our collections in about a 4-month period by 2.5 million. Now, in our organization, that's not a lot of money, but 2.5 million straight to the bottom line is always a good thing. And our previous system was missing some of that. So we're trying to get more and more analytics on, did we get paid the right amount? And if there's a denial, how did that denial occur? And what's the best way for us to handle it without having to route it to a person? Is it simply a correction and rebilling for certain denial codes, et cetera?
Yeah.
Now, if the questioner, if I'm not hitting the points, I'm happy to expand upon specific areas that are of interest.
Perfect. So if you're listening, please add to that question if need be. Also, 2.5 million. I mean, I'd be happy with 2.5 million added to my bottom line, no matter who you are.
Absolutely.
Yeah,
No.
Exactly. Hugh, this one is also for you. It says, we've also got a large union presence. Any tips for negotiating with them and calming their concerns during these types of implementations? And I even heard Dean mention this as well. So maybe both of you guys can chime in here.
So what I would say is that, so our shop, as I said, has 2 unions. So far, the nursing union has not been affected by this at all. In California, we have mandated nurse staffing ratios. So there's not a lot we can do to change anything related to nursing service, except perhaps help the nurses be more efficient in what they're doing. So our focus has largely been on non-nursing, non-clinical activities. And I think right now is an opportune time. As Dean pointed out, there's a shortage of people. And so there are people that are being asked to come in and work weekends, work overtime for shifts that they would not normally have to cover. So what we're trying to do is implement technology in areas where we can supplement what they're doing. For example, the registration kiosk, where they really don't feel it right now. Now, at some point in the future, they will. And we've spent a lot of time working with our HR department in what methodologies we use to communicate, not just with the union, but with all of our employees as we roll out a new technology and how that technology will be a benefit to the patients and in many cases to the workers by eliminating drudge work or eliminating a requirement for overtime or to work on the weekends when they're not scheduled for a weekend shift. I'm not sure it would be as simple if we were at a full employment model where there were people waiting in line for jobs. But for right now, I think we got lucky and we're implementing projects at a time when there are labor shortages and there just aren't people to fill the jobs.
Yeah, and Chandler, if I can add, and I think Hugh's points are dead on. What we've got here is a situation where labor shortage is almost critical, and nursing shortage is certainly one of those areas where it's very, very significantly impacted. So the ability to, as he put it, take the drudgery out, but take what I refer to as volume, low value tasks, administrative burdens that can be taken off of the nurses and enabling them to do the clinical aspects of clinical care, patient care, without having to do some of the more administrative things, I think works to the benefit of all parties.
Mm-hmm. Absolutely. No, I think both of you guys hit it right on. So we have 3 more minutes, and this question is for both of you, just kind of to wrap us up. What has been the most surprising way either of you have heard or seen a provider or department using automation? Any fun wins? Any fun stories?
Yeah, I think what we're seeing is more and more inclusion of gathering of the information, right? And I know Hugh talked about it, we've talked about it, but we're using QR codes now to enroll patients into programs, platforms, clinical programs, and it's everything from compliance to smoking cessation to diabetes management to HEDIS questions. I think people are just opening their minds to what is the possible.
Mm-hmm.
So it took me a moment, but I thought of one really interesting anecdote. This didn't happen at Palomar. This was another system that I worked at, but we had implemented a technology to more accurately compute what the patient's deductible and copay would be when they had a visit to an office. And we also had implemented a point of service collection bonus plan for the registration clerks. And at that particular institution, at certain shifts, registration and cashiering were combined. So we had a gentleman come in that had burns on his hands, and he got treated in the ED. And when he got ready to check out, the lady said, "Oh, here's what your copay and deductible will be. And we're happy to take a credit card, cash, check, whatever you would like." And he held up his hand and he said, "Well, I pay by credit card, but I can't get my credit cards out." And she goes, "Just a moment, sir," walked out behind the counter, asked him if this was his wallet, pulled his wallet out, opened it up, asked him which credit card he wanted, pulled the card out, ran it, put it back in, put his wallet back in his trousers.
Oh, no.
I thought that was a pretty bold move on her part, but she got recognized for her initiative.
Yeah,
So,
please tell me they won the bonus.
oh, they absolutely. So the bonus was we would take them out to a particular steakhouse located near the hospital, and they got a cash bonus, but also we told them, here was your target, here's your overachiever goal, and if you hit the overachiever goal, we'll take you all out for steak dinner at this particular restaurant. And they did. They blew the doors off. So we took them to the restaurant, and it was a great experience.
Highly motivated.
But that's one of my favorite stories about a motivated employee.
Seriously. Oh my goodness. Well, thank you both, gentlemen. This has been absolutely amazing. For those of you listening, please feel free to submit more questions to both Hugh and Dean in the Connex community. I will be dispersing them. And again, thank you, gentlemen. And I hope that everyone listening has a wonderful day.
Thank you so much.
Thank you.
Thanks, everyone. Bye-bye.